Medicine, History, a Time Forgotten. Medicine is an interesting topic. It's unlike other topics I've done on this channel. It has a slow evolution and over many different nations and ages. It starts in the Neolithic age and stretches to modern day. Well, the early man in the Stone Age believed in many different medical treatments. For instance, diet. They believed that diet could help heal bones or broken limbs and help them regrow faster. For instance, if you had a skin condition, eating more fruit than meat could help you. Trepanning. They believed most of the Stone Age beliefs were in the supernatural. They believed that demons were stuck in the person's head when they were ill, and the only way to remove them was by trepanning a hole in the person's head. It was very spiritual, as I've said, demons and devils in people's heads that would cause them to be ill. They also started using basic dressings for wounds. They would cover them instead with leather instead of just leaving them open. After the Neolithic age, we have the Egyptians, Romans, and the Greeks. The Egyptians brought diagnosis, which means they would note down what was wrong with the patient, and decide what was right to heal them. They recorded all of their patients' problems to know what to do if they encountered it again in the future. They had early dissection. On the death of a pharaoh or of some other patients, they would remove their organs and put them in separate jars. They discovered that honey was an antiseptic, and they would dress wounds for them to heal faster using honey. The Romans brought further dissection. They used pigs because it was illegal in the Roman age to dissect humans. They also were very sanitized. You can see a Roman pipe there, which would take sewage out of the cities. This sanitization meant that there were much lower disease rates in Roman towns and cities rather than Greek or Egyptians. They had early caesarean, midwives, and labor care, which meant that they looked after women who were having children. They were one of the few civilizations ever to do that. The Greeks introduced the Hippocratic Oath. Hippocrates was a scientist and practitioner in the Greek age, and he was by some thought to be the founding father of medicine. The four humours. The Greeks believed that there were four humours in the body, and if these humours were unbalanced, that would make someone ill. To cure someone, they would balance the humours, for instance by bloodletting or making phlegm come out. They recorded and compared results of their surgeries so that in the future they would know how to cure patients with similar symptoms. They found out the brain controlled the body and that blood travels through veins. Medieval medicine. They believed that if they followed the church and were nice people, that they would not feel pain. They believed in spirits possessing their minds and causing them sorrow and pain. They believed that bloodletting would get rid of the bad the demons that were in their bodies. They used fires to burn out the diseases from the air, and also they seeked God's forgiveness by hurting themselves through maces and other such weapons. This was found in the era of the Black Death. Tudors, Stuarts, and Georgians. Tudors, Stuarts, and Georgians used herbal remedies, which they believed would cure patients. They used bloodletting to run the disease out of the body. They had barbers, which were dentists as well. These were the first dentists. They would remove rotten teeth. They believed that they found out that stool was connected to disease, and if the stool's consistency or texture was different to usual, that their patient usually had a problem. They thought arsenic was a good medicine, but now we know that it is a dreadful poison. They believed that pain would cure madness, and they believed that burning witches who would solve their problems, as they believed that witches had caused the pain. Victorians. Victorians find out about microorganisms infecting the body, and they made vaccine to cure viruses, and they found penicillin, which was the first antibiotic which could cure bacteria. They found that sanitization in their hospitals, as shown by Florence Nightingale, would make their work much easier. They also used pasteurization so that milk and other products would not sour easily and cause more problems. In the modern day, we use masks to protect our doctors and our patients. We have surgeries to replace broken limbs and broken and faulty organs. We have transplants, which involve taking organs and putting them into another person's body. We have non-biological vaccines. The recent COVID-19 Pfizer vaccine is not made using the classical method. It is made by fabricating the vaccine in a lab, which was much quicker. We also have life support, which allows people who have zero motion in their body to still remain alive. Conclusion. Medicine has come a long way. It is less based on the church and superstition now, but on science. We know the importance of sanitization, and all of our knowledge at the moment is based on old theories from the classical age. There is no doubt in our minds that medicine will keep evolving to heal people for the better. The end.